but this is the subject of today's talk, where we are joined by Lizzie and Mel, who are both from Queen Mary University in London, alongside the PPIE contributors Mustafa, Sulima, and David. Apologies. Lizzie recently finished her PhD, which focused on training and evaluating clinical language models using large structured and electronic healthcare records. That was a bit of a mouthful. And Mel is a qualitative researcher based also at the same university that's currently supported by NIHR Pre-Application Support Fund, and her work focuses on patient experiences with long-term health conditions, tackling digital health inequalities across the UK. Apologies, my voice is a bit raw today, so I'm struggling to say exactly what I'd like to. But without further ado, I'll let you guys take over, and I'll stop sharing my screen.
Thanks so much, Sophie. And before I cover the screen with a new set of slides, I'll just hand over to Lizzie and the team in the room to introduce themselves.
Thank you. Just to say, we're expecting Sulima, but she is going to join us in about 5 minutes' time, so I will just need to disappear and pick her up. But joining you from Whitechapel in East London, my name is Lizzie, and I am now a postdoc at Queen Mary. And over to you, just your name and where you're joining from.
Oh, yes, my name is Mustafa Kamal, and well, what I can say, I joined here quite long time ago. I think it's almost 2-3 years running.
Yeah.
Yeah, and we did quite a few projects together.
Yeah.
Hi everyone, I'm David. I'm a community facilitator here in sunny Whitechapel. Yeah, I'm here with these guys.
Yeah, and we also joined by Sulima, who is one of the other PPIE contributors that we all work together on this project.
Thanks very much, team. I am going to share the slides. Can everybody see those okay? If you're giving me a thumbs up, I can't see it because my screen is frozen.
Yes, we can
Yes, we can see it, yeah.
Thank you. So I'm going to start off with a bit of an introduction to the project and what we've done, and then I'll hand over to the team in the room who are going to do a bit more of a question and answer session together about their experiences. So as Sophie mentioned, we are looking at co-designing animated videos to explain large language models and their use in healthcare and research. So our reason for doing this is large language models are being used more often in healthcare and research, for example, by clinicians to write and transcribe clinical notes, by researchers to develop clinical decision support tools, and by patients increasingly to ask health-related questions. Most of these tools aren't designed in collaboration with with patients, who are those who are ultimately impacted by using these tools. I have here our kind of definition of PPIE, so as research being carried out with or by members of the public rather than to, about, or for them. It should be an active partnership between patients, carers, and members of the public with researchers that influences and shapes research. However, most AI research doesn't currently include any PPIE, and researchers have said that including PPIE in large language model research is challenging due to issues such as limited resources and funding. There's a perception that there's a need for technical knowledge to engage with the research. 73% of adults in the UK have had no AI training or education, and hype and public narrative of LLMs can impact the perspectives that people might bring to this kind of research. So the aim of our project was to co-design AI literacy materials that can support PPI contributors to get involved in healthcare research that uses LLMs. We wanted materials that we could use to help set the scene and introduce PPI contributors to LLMs. And we had done some research prior to starting this where we found that there really wasn't a lot of material that was accessible to the general public. It all assumed a certain level of technical knowledge. So for our co-design process, we worked with a local charity in Tower Hamlets, Social Action for Health, and invited 6 PPIE contributors who are not normally involved in research. You guys in the room can see yourself in the photo there. We had a team of 6 PPI contributors and 5 academic researchers from different institutes in the UK. And we additionally recruited Bengali English translators to help on the project as we moved it forward. For our initial workshops, we explored how LLMs work. So we used interactive games and tried openly available LLM-based tools like ChatGPT, using different prompts to explore how they work and what the capacities and limitations of those might be. PPI contributors were also invited to share with each other any experiences that they'd had using ChatGPT or other commercially available LLMs. And we also use things like these sentence and pattern completion games to try and demonstrate how LLMs learned patterns and use those patterns to complete sentences. So you can see at the bottom we have a what symbol comes next process. Based on the conversations that we had in those initial stages, we identified things that might be important for inclusion, and we took an iterative approach to developing the script and the visuals for animation. So what we have here on the screen is the transition from a scribble on a big sticky note that we did in the session together, and then it's movement through to a slightly neater sketch to something put together on PowerPoint, and then in D, the final image from the animation itself, to show how the PPI ideas contributed to the final design. And I'll go back to that one. That we followed the same process to develop the script and to develop other visuals for the animation. So revisiting over a series of 7 workshops, including the introductory workshops, what topics we felt were important to include, how we should phrase particular aspects and issues, and as I've demonstrated on this slide, what we felt was a useful visual representation of the material. And I have, hopefully this will work, one example of the animations that we produced.
Thank you very much. Just to say on the back of that, so we actually ended up with, in total 4 animations. So we made one animation that was just around what are LLMs like in general life, and then one specific to how they're used in healthcare. And because this wasn't attached to a specific project, that's why it's like quite broad in the content that it contains. But just to give you an idea of how we are using some of these animations in our work, kind of the way that they have been used so far to support kind of research is being used as an introduction, as a way to support conversations around LLMs in general. So you're being used to kind of surface questions and queries and thoughts from PPIE contributors at the beginning of a project, as a way of kind of learning a little bit more about LLMs. And so some of the projects that as a research team we've been using them in is using LLMs to extract information from unstructured clinical text data that can help do kind of predictions around hospital admissions. And so kind of at the beginning of this project, it was used as a way of kind of like the first time of PPIE contributors getting together, as a way of kind of facilitating the initial conversations. And they worked really well in collaboration, using them with other animations. So there's a lot of really good kind of work done by understanding patient data, and they do get a lot of good videos and materials for supporting and understanding about how healthcare data is used. Yeah, and some other kind of materials on YouTube. I think some people from this network also made a good animation around statistical methods to kind of support learning. Could we get the next slide, please? Yeah, I think somebody put a question in the chat for a link, so we'll also send the link, but you can also scan the QR code. Yeah, so these animations are for supporting PPIE work and public AI literacy. I would also say that as a group, we can also talk about it later, is that there's a more general, well, there's two more general animations, one in English and one in Bengali, that's just about LLMs in our daily lives. And these are being used just to support public AI literacy, so not necessarily PPIE research, but just so people in the community can kind of learn a bit more about LLMs and how they work, particularly as more and more people are starting to use them. Yeah, so you feel free to use them in your own work if they're helpful, or to share. They're available on our university's website, but you can also just share the YouTube links like in WhatsApp messages and things like that, so they're quite flexible. Next slide, please. What we're going to do for the next maybe, I don't know, 20 minutes, maybe 50 minutes, we thought we would kind of have more of a Q&A session between the researchers and the PPIE contributors who are joining us today. So to start with, the research team, which is me and Mel in this case, have got some questions for our PPIE contributors. So we're going to explore some different parts of the project and how we work together, and you know, any issues that we had. And then the PPIE contributors are also going to ask me and Mel some questions, again, to kind of explore some of the project and kind of what has worked well and what hasn't worked so well, and maybe what we would change in the future. So I'm just going to check that. So if you could say something, can everybody hear? I don't know how good this microphone is. Can you just?
Hi, my name is Salima. Can you hear me?
Is that
we
good?
can hear.
Yeah, perfect, cool. Yeah, there's a big room. I don't know if you know the space. Huge screen. Yeah, so we've got 3 of our 6 PPIE contributors with us. So I'm actually going to ask all of them at the beginning. Why did you get involved in this project, and what did you know about LLMs before you started? So I'm going to start with Salima.
So I got involved because it's something new. I've not done research before, and it was something that I was quite interested previously. You know, heard around in the community and stuff, but not as much. And then when staff, you know, came to me, and I was like, yeah, you know, I'll give it a go, see how it goes. And then once I was involved, I didn't have much of an idea of what like LLM was. That I was already using certain like Google, and you know, like we are using some, but not as much. But yeah, so I just, you know, made me feel that I wanted to know more about it for myself, as well as being involved as a PPIE for research.
Great, thank you.
Yeah. Oh, thank you. Well, actually, I learned the computer by myself. I can use almost many softwares, and I can work with many things. And with the process, I am little bit was familiar about the AI, because it was my self-taught things. Nobody actually told me what is what, how it's worked, and so on and so on. But I was really curious about the AI, or what is a LLMs, how it worked. I had little bit ideas. When I type in the Google give me the answer, but it was a puzzle. How it's doing, where it's coming from. So that's why when I learned about this research, so I was really interested, and I came in, and after, you know, in the beginning, we had a mix of groups, and the people has little knowledge or no knowledge about LLMs, and gradually we actually learn about it, and thanks to you and all other involved people, we were able to make a short, you know, the animation in a very simple way to explain what is LLMs.
Thanks for that. David?
Oh, so okay, so I do work research in the community anyway. Oh,
Camera. Yeah, yeah.
you can tell I'm not camera friendly. So yes, I do other research projects in the community, but I was drawn to this one because I wasn't sure of the crossover between LLMs and healthcare, and I wanted to see what that was and how those things went together.
What did you know about LLMs?
Oh, yes, there you go. Right. So I've got a mid-level of LLMs. So I will use them, for example, with writing letters, email to polish up, and give you, I don't know, a rough draft after you've done something. So I had a working knowledge of LLMs. So somewhere in the middle, not at the bottom, not at the top.
Yeah. So I think there was quite a mix of knowledge when we started. Some people had never heard of LLMs before. Some people had used them. Some people had heard about them through their kids. The real mixture. So that was kind of why the introductory workshops were quite important, where we actually kind of got hands-on. We used ChatGPT at the time. We tried out different prompts, and we did these kind of kind of activity games that Mel showed you earlier, so that we could kind of all learn together what they were and how they worked. Yeah, I'm going to ask you kind of what worked well during this project, like, you know, how, yeah, what do you think was good about the project?
I liked it because everyone like really got on with each other, although all of us came from different backgrounds, but at the same time a little community as well. I think that really worked well as we went along with, you know, the whole project itself. And I thought that for me was very, like, I felt confident. I didn't feel like without that support and that confidence with everybody else, I don't think I would have been able to carry on. But yeah, no, I think that was really like a strong bond that we all like managed to have from the very beginning. It wasn't even like after a few sessions, I think we all really, like with Mel, when Mel was here as well, and Lisa, everyone, we were just like, let's get on with this. And it was just really nice because we weren't, and there was no like, oh, someone knows more and someone knows less. We all just, you know, really supported each other. And I felt that was really helpful.
Yeah.
Yeah.
Do you know, can you say anything, what made that support, kind of why was it such a supportive atmosphere?
I think because most of us like have similarity of like the community that we are already in. And so I felt that was quite strong, coming from like, you know, the similar area and the knowledge that we all had. I felt like we all just, it wasn't like I know more and you know less, and it was just like we just all really like bonded quite nicely with each other. So I felt like it was just really easy to get on.
Thank you. Yeah, so this research all took place in Whitechapel, which is where Queen Mary is based, and that is also why there's both English and Bengali animations, because Bengali is the second most spoken language in Whitechapel. It's the biggest Bengali population in the UK, so it's very important for us to be able to provide materials in both languages. Yeah, and that's why we also worked with translators and bilingual speakers to make sure that kind of the translation was appropriate and the right words and the right meanings were found.
Right. Can I just add with this?
Sure, jump in.
You know, I think, you know, how actually we work together, because we had different people and we had different understanding from the different level. But Liz and Mel, they work really hard. And you both say, I still remember Mel was doing all these drawing and she was taking the notes, and when she bring it on the next day, it's actually refresh our memories, and it's actually help us to understand more gradually and more quickly. And I think Mel did very good job, and thank you very much. It was wonderful, and she did little bit of the animation drawings in the beginning. It was fantastic.
I promise I didn't pay him to say that.
I think it was, I have to say, very helpful having someone with some drawing skills, because there was a lot of ideas around how we wanted to visually represent it. But I think most of us were kind of limited to stick figures, and yeah, Mel did a very good job. But yeah, David, I'm going to ask you that how can we support more people, more PPIE contributors from diverse backgrounds from the community to get involved in research, and particularly kind of AI research and LLM research as it's becoming more common?
Okay, so I think working with non-profits like charities, for example, working with institutions like mosques, synagogues, gurdwaras, places of trust. So there's an issue, a barrier. Oops, what are people?
Oh no!
It's my voice. I've killed it.
Oh, we can hear you and see you still.
Oh, hang on, it's just the screen that's turned off. You carry on going,
Okay,
David. I'll try and.
We pulled it. So yeah, I think especially with diverse communities, there is a barrier of trust, and so getting around that by working with charities and institutions in the community gets around that trust and gets more engagement from those groups of people. I also feel though that sometimes with research, it's kind of who you know that gets you into research. So if you don't know anybody, you can't get into research. So I do many groups. I've been doing this for about 4 years now. And lots of people would take part in research if they knew about it and they knew about the avenues of how to get into it. And I think that's quite restricted. It's not common knowledge enough to engage these people.
Yeah. I think that's something that we were really interested in when we started this project, was to work with people that maybe hadn't been involved in AI research before, but also to support more people to get involved in research, because where we are based in Whitechapel, Queen Mary is a huge university, lots of research is happening, lots of health research is happening. Not that many people are actually involved in the research.
I think also people would, a lot of the community would be interested in learning about AI or large language models because it's dominating the press. Everyone knows about it, but they don't understand how it works. But they would be interested in learning about these things and how that could affect their lives.
Yeah, thank you. Mustafa, how did we share all of these materials and animations? Where did you take them? How did you share them with the community, or have you shared them with the community?
Well, I think that first of all, it was we have got a proverb in Bengali. What is the name of the tree? Look at the fruit. When you've got the fruit, then you say what is the name of the tree. So our first achievement was to successfully make the animation. That was the first foundation of our success. And then secondly, I believe we had some screening on the local area with the local people and inviting some other, the people who was interested. And thirdly, it was on the YouTube. It was open to everybody. But most importantly, I think it was last year, we went to Glasgow and we participated in a, I don't remember what's the name of this.
HEALTAC is a natural language processing conference that happens every year in the UK.
Yeah. And from this group, we actually participated and we bring our film and we explain what we did, what we achieved. And very interestingly, it was really great honor to achieve the first prize. I think our group was won the first prize. And we present our film, ourselves and our work in front of many delegation who was coming from all over the UK. There was a big auditorium, there was a lot of people, and it was really very nice to share.
Yeah, and it was a good time had in Glasgow. But if anybody does kind of NLP work in the UK using electronic healthcare records, it's a really great conference. Yeah, it's I would definitely recommend. And yeah, we enjoyed it there. Okay, this is one for all of you. Given how much the awareness and the use of LLMs have changed, because when we started this project, this was in 2024. Some of us had never heard of LLMs before. It wasn't, we spent a long time talking about whether we should call them LLMs or large language models, or if people just called it ChatGPT, what were the best terms to use, because it wasn't as common as it is now. Given all of that, is there anything you would change in the animations now? Or what would you change, if anything? I'm going to start with you, David.
About the music.
The music.
What we change? Probably I would think about maybe showing more of the applications that people use. So to make that connection, so people might use, I don't know, Claude, Gemini, some phones, isn't it? ChatGPT, and maybe showing that more visually, then connects that with LLMs, so people know, oh, ChatGPT is an LLM. Claude is an LLM, Gemini. So maybe I would have maybe done that perhaps.
And I think we did, there was a nice precaution put on the animation that do not put your personal info, like your date of birth or your bank details, so on, so on, which is because it's an open platform. Anybody can retrieve and it can be harmful for yourself. So that was a nice thing we did. And overall, I think, I want to keep as it is because it was our first work. It was our first work. I don't want to change it. Let's be like that. And if you want to, yes, exactly. If you want to change it, do another one. But other thing what we can do, we actually can translate it in different languages for other people. And there is many other people who don't speak English, but they have got a different language. So if we can translate it in a different language, I think that would be very helpful for the other people. We're not thinking about the English and Bengali speaking people, we're thinking about other people who is in the UK.
Yeah.
So I think that will be a nice idea to do.
Just to say as well, something that Mustafa was talking about there is in the other animation that's kind of just about what LLMs are in general and how they occur in our daily life. In that one, we do talk about some of the risks in putting or kind of your personal details. If you put them into an LLM, they could be shared with others, and that's not so present in this kind of healthcare focused animation. And we did at the time also talk about whether we should include other downsides of LLMs. We talked about the environmental use. We decided not to include it. We talked about things like bias and kind of misrepresentation, and that was quite a challenge sometimes to balance like what we wanted to include, given that we only had was it 2.5 minutes?
To shorten it.
You've got to think about what things you want to include and what things you don't want to include. What is important to people to take away? What are the things that are not so important? So yeah, it was always a challenge to work out which was which.
Yeah. Salima, would you change anything? What would you change?
I think I agree with what Mustafa and David said. Like, I agree with the fact that, like if you had there's a little bit more vision about the AI, like actually what we've been using. But at the same time, I would leave it as it is because it's just, it's amazing. I think it's really nice and understanding. And also like things that you've just mentioned, like we missed out on like what the environmental, that was quite important as well, but we had to choose what was more important. But if make it a little bit longer, like just maybe like 20 seconds longer, just to add a little bit in, that would be quite nice. But I think, as it is, it's just amazing.
Yeah, we did. I mean, we also talked about this the other day when we were preparing for this, that some things we intentionally tried to design it so it would age well. Obviously, this is a space that changes very, very quickly. So when we started this project, it was actually quite difficult to find examples of how LLMs were being used all the time, but now you have so many examples on Google Maps. It's like summarized by LLMs. You have like a Google summary now when you open Google. That didn't actually exist when we started the project. But I do think this kind of core analogy of the factory remains true of kind of how LLMs work. Regardless of all the new ways that they're being used. But okay, now it's the next slide, please, Mel. Now it's time for you guys to ask us some questions. You can choose me or Mel. Mel, you can't see her on the screen, but she's there somewhere. So
I want to start. Okay.
Yes, please.
Right. But the thing is, the teaching profession is a very noble profession. Yeah. So when you teach a university student, it's a different. But when you teach a primary school, the nursery children, it's very difficult because those children, they don't understand anything. They're crying, they're shouting, they're doing this. But controlling them and teaching, I think that's the most difficult job. So how did you feel working the people like us who had no idea about LLMs and
You compare us to children.
we're not even nursery kids, yeah, because we had no knowledge about it.
I didn't compare, I don't think that's a fair comparison there. You guys all brought your own lived experiences to this. I learned a lot from the process. I don't feel like I think the initial 2 workshops where we were talking about how LLMs worked, I do think that was something that was led by the researchers. We made ChatGPT available, we made kind of those pattern games. But after that, it was very much kind of shared knowledge. Like you had as much knowledge as we did. So I think there was no crying, there was no screaming, there was no yeah. And I think actually it was really useful having such a diverse range of people's experience, because some people like Tanya had lots of experience with LLMs and had her own ideas around how they were useful or how they were not useful, or some of the problems with it. And then someone like Lisa had never heard of it before, and so it was a very good way of making sure that actually what we were making was appropriate for everyone, because if it was understood by everyone in the room, then it could be understood by many different people. Mel, do you want to add anything?
I guess just wanted to add that it's nice that Salima mentioned that kind of positive atmosphere, and I really felt that, as you said, that we learned a lot from the group, and that I felt, at least to me, and I feel that it showed in the kind of final versions of the script and the animation ideas, that the group felt really able to express their ideas and to challenge us about what should and shouldn't be included, and to kind of reach a consensus as a whole group about final decisions, rather than it feeling, to use your unfair comparison, Mustafa, that we're, corralling the group to do what we want. It was more, it really did feel that everyone was bringing a different perspective that we were able to bring together.
Any other questions?
I think I was going to ask similar to what Mustafa, but just what was your expectation? Like, how did you first, when you your experience with us on the first day, like what did you guys think of us? How did you feel about that? Or
the expectations of the project?
So, like in the project and with us being involved, like how?
It's a very good question. So for me, this was the second PPIE project I've been involved in that has been kind of co-designed with people with lived experience. So I had lots of things that I didn't want to repeat from the first project, like lots of things I'd learned that I didn't want to do again. So I think it was nice that it was much more, I think the co-design process for me was much more inclusive. So the previous work I did was much more, it was about setting research priorities, and so then it felt much more led by the researchers, whereas this project felt more shared. So I think that was like my expectation, my wish, my hope for the project was that it was more equal. And I think that was true in the end. I think there's still a lot of structures and barriers to academia. Like I had to be the one to apply for the conference. Mel had to be the one to apply for the funding. These things kind of structure a little bit how the project worked, and meant that it couldn't always be completely equal. but I think in general that was my hope for the project. But
Yeah, no, that came across quite nicely like that.
Mel, do you want to jump in?
I guess I just wanted to add that maybe as the kind of team of researchers applying for the funding, we were maybe overly optimistic about timelines, and one of the things that I think was really valuable is actually that we took more time, we had more workshops to make sure that everyone was being kind of kept in the loop as things progressed, rather than us seeing the group and then coming back with a sort of pre-made decision a month later. So I think, you know, it ultimately was a really beneficial aspect of the project, but required Lizzie and I to be a bit more flexible in our thinking, and I'm sure many people on the call will have also experienced this, just coming up against deadlines for spending small pots of funding without much flexibility, so then kind of feeling under pressure to be at particular stages at particular times of the year where maybe you'd want a bit more time, rather than dragging people in over the Easter holidays to come and meet and discuss.
Yeah, I would say as well, so we originally budgeted for 4 workshops and we ended up with 7. So we really had to do some rearranging of like our timelines, our expenses, but 4 just really wouldn't have been enough. And we could have actually continued for longer, I think, had finances and time allowed. I think there's another slide, but I think it pretty much kind of, we wanted to open up for questions from everyone else. This is just to say these are our funders and also all of our collaborators. We also have Sarah on the call, who is one of the other researchers involved in this project. So if Sarah wants to kind of come on and answer any questions as well, that would be great. But yeah, we received funding from Queen Mary, the Centre for Public Engagement, and from the PPIE fund at King's College for this project. And thank you very much. And any questions to the room, or to Mel, or to Sarah?
Hey, well, sorry, my voice is still not quite here, but thank you very much, guys. I really enjoyed your presentation. Thank you, everyone, for sitting in the hot seat. The nice thing about it is that basically we've had a warm up to questions, so we'll see if there are any questions that come. Although I really enjoyed just tuning into your conversation. It was fun to follow the thoughts that came up. There was a lot of different themes within your presentations, you know, classic kind of PPIE themes that you need to build relationships, leaning on creative methods, which I sometimes find from looking at the presentations that we've had previously in the seminar that a lot of people look towards creative methods to help facilitate discussions on the more technical topics. And I love the animation as well. And we did get some comments, I think, asking to share the animation video. So we would love to share that through our channels if you could send it our way. I think language is always challenging in PPIE as well, particularly if you're in a subject area that's changing as rapidly as it is and everyone has an opinion. So I have lots of different thoughts. I guess one thought is, to what extent do you think PPIE as a process is kind of a journey to consensus? And do you always have to sort of iteratively go back to sort of build understanding and relationships amongst you and your team as you go through the process? And what do you think are the challenges as well of doing PPIE within a topic area like this? I don't know which of you or who wants to start. But go for it. Yeah.
And maybe our PPIE contributors also want to add
Yeah,
something to this,
please
but
do.
I think it is really important to have those iterations and to go back to you know, to come back together to build on both the kind of knowledge and the ideas that you develop in the previous session. Feedback that I've had from PPI contributors on other projects is that often they feel that researchers kind of drop in, extract information from them, and then they never hear anything from them again, or they come back in a year's time with some findings or a new set of questions for them. And I think that particularly for this project where we were trying to develop something that's very public facing, it's really important to have a group of people who can say, actually, this wording is too technical, or actually, this is a poor example. So Lizzie mentioned that the other video was about LLMs in general, and we'd had an example that, it could help you with your homework. And very sensibly, the parents in the room were like, let's not have that in the video. So, even just on those kind of minor points, coming back together and evaluating what you had come up with the last time, I think was really important. I don't know if the team want to add anything.
I can add something as well. And I think yeah, I'm trying to think about how to say it properly, but I think something I have thought a lot about, and it's been really a nice experience working with Social Active Health, which is our partner based in Whitechapel. They're a charity that work with people living with health inequalities. Is that a lot of the PPI contributors that I've worked with haven't been involved in research before, and there's a learning curve where you're developing a relationship and trust, but you're also developing a shared language around how to talk about research and what it means to be a PPI contributor and to do PPI research. I think in academia we make so many assumptions and use so much jargon, and we all have this idea of kind of what we're doing, but actually that makes almost no sense outside of academia. Just like the concept of writing a paper, like why would you do that? The process of it, you have to kind of like look at some of those and explain some of the reasons behind things. And that is definitely a process where you can kind of learn over time and support PPI contributors to kind of go on to other projects or into other research rather than being like a one-off event. I think what David was saying earlier is that a lot of people are very keen to get involved in research. It's just kind of making sure that they are supported to do so, and like maybe being more flexible. I think maybe that's like where using creative approaches might come in, because they're like can be quite fun and friendly, and that's less serious than sitting down and reading like a 20-page document, which has so many expectations that you need to be able to speak English and you need to be able to access the internet and like do all these other things. I don't know if anybody wants to say anything about that or add anything.
Well, no, it was overall is a very good experience for us and the people who get involved. And I think everybody has get quite a lot of knowledge and something very good experience. So it was very nice. And I think you should continue doing things like that.
Yeah. I think that's one of the challenging things as well about research, is that you would like to continue working on projects or with particular groups of people. But it's like, for example, I've just finished a PhD. Maybe I've got a 1-year postdoc position. Who knows where we all are in a year's time. And that's obviously like a much bigger systemic problem. But it's not always easy to continue on working with people or working on a project.
Definitely. I've just completed my PhD too, and I'm in the same boat. So, and I had the same thing as well, where I'm still in contact with some of the people I was working with, and it's just figuring out what's next.
Yeah.
And that answer isn't always obvious for the individual either. But yeah, so I think my sense of what you're saying is that you need to kind of be open minded for each time you're engaging with the PPIE, regardless of the topic area, because sometimes you'll need to talk about things that aren't necessarily to do with the topic, but about maybe research more broadly. Why do we do it the way that we do? And I think you just have to be open for those sort of discussions. It's kind of the answer that I got from you all, and just keep engaging, keep going through multiple iterations until you build a level of understanding that everyone's happy to move forward with. But yeah, okay. Are there any other questions from anyone else on the call? Okay, well, in that case, then what we'll do is we'll end the session here today. But thank you very, very, very much. I've really enjoyed listening to all of you have a discussion. It was nice to be able to just sit in the room with you. So thank you very much for your presentation today. We'll upload this recording onto YouTube so you can share it through your own networks. And I'll also make sure to share the links that you put in the chat. Thank you, Lizzie, which are fantastic. So yeah, so good work, everyone. And thank you very much for joining.
Thank you very much.
Thank you. Thank you.